.5 Soufriere FM. It's now time for Casualty 911 for today, Monday, the 8th day of April 2024. A special good morning to you.
Good morning, Cabrina. I hope all is well with you. I quite enjoyed the time spending with you this morning before we start the program. I guess you really put a smile on my face and, you know, give me a little hype up this morning. Thank you so very much for that. And let me say good morning to all our listeners and persons out there listening to us. It's always a pleasure to be here on 88.5 Casualty 911. And again, the Ministry of Health is always there to provide you with information that you need, that is essential, that can be an integral part of your life. And yesterday we recognized World Health Day. And under that theme is My Health, My Right. And we know as human beings, we have rights. We have rights and a lot of rights, and we have the rights where to have access to quality healthcare services. And I know many people might say, what quality healthcare services? But I can tell you right here in St. Lucia, we have some good quality healthcare services. You have the right to education and information, and that is why we are here today, as well as safe drinking water, clean air, good nutrition, quality housing, decent working and environmental conditions, and freedom from discrimination. So, under that theme, my health, my right, I will just say what we really want to talk about. You have the right to have safe and quality health care without any discrimination. And by that, we mean when you come to our wellness centers, our hospitals, you have the right to get quality healthcare services. I know many of you come to our wellness centers, and maybe the approach that you might come in might not be the best, but at the end of the day, our professionals, our doctors, our nurses are trained to provide you with quality healthcare services as long as they have the resources available. They try their best to provide you with these quality healthcare services. To privacy and confidentiality for your your health information, and that's one of the things we pride on ourselves doing, developing public confidence when it comes to our persons accessing our services, especially our public health services. When you go out there, we want to ensure that you have that rapport with our healthcare professionals, that you feel confident that whatever happens there will stay there and nothing will be out there to the general public. And you have the right to information about your treatment and to inform consent. And one of the things we have always been saying, ask your doctor questions, ask your nurse questions. Don't be afraid. When they give you the medication, speak to your pharmacist. If you're having problems with the medication that is being prescribed, ask your question, come back. Make sure that you are comfortable with what you're getting, what you're using, and develop that rapport with our medical professionals when you go out there. Don't be afraid, and that is why they are there to provide you with that level of service. I know many of us are quick to diagnose ourselves, but again, you are not the healthcare professional, and you have to give them time to provide you with that kind of information that you need. Bodily autonomy and integrity, of course. Again, that's one of the services that we provide, and we encourage people to. I mean, different communities have different approaches to our healthcare system, different cultures in different communities. And, all of these things, when you come to our healthcare service, your approach, what you do, what you say goes a very long way. And make decisions about your own health. You have the right to make decisions about your own health. And today, that's one of the things I really want Nurse will be speaking about. Why are we so afraid to come in and seek medical attention when we see signs and symptoms of certain diseases? Why are we so afraid? The fear. Um, if you don't feel comfortable with our public health system, our wellness centers, you can go to the private entities that are out there. So why not make use of the systems that are available when we are now seeing signs and symptoms of certain diseases? It's your decision about your own health. So you can say yes, I want to seek medical attention. No, I do not want to seek medical attention. But when I say no, I do not want to seek medical attention, you have to think of the repercussions, because you are putting yourselves more at risk. And although it's my health, my right, but you have to think, and you have to think well before you make a decision. Even when the doctors and the nurse tells you something, you still have to think. You still have to make an informed decision what is best for you. And there is no reason why you cannot get a second opinion. It is your right also. Yeah. And these are the things that we really want persons to think about when it comes to your health, your right. That right do you have? Are you making very good use of it? And I want the public out there to think about it, especially our younger persons between the ages of 20 to 40. These are the persons that we don't really see at our wellness centers. And these are the persons that might have underlying conditions. They see the signs, but they tend to ignore it. And these are the persons that needs the information that we're bringing out there so that they can change their lifestyles. You know, when you're young, you're vibrant, you tend to sleep less, you tend to have more of a carefree attitude, and most times that's when it all starts. That's when you start damaging your health. That's when you stop taking care of your body. And so that's when you consume, some of us consume more substances like alcohol and so on. And that's the time you feel one life to live, let me enjoy myself. But at the same time, you know, you're doing more harm than good to your body. And even if it's your right, but you have to think, like I said, of the repercussions of all of these. And we're hoping that we more young persons come into our wellness center, access the services that are available. There are so many services available. We have our doctors, we have specialists coming in at the various health centers, we have the Cuban eye clinic, we have dermatology for your skincare and so on. We have podiatry for food care for our diabetics. We have so many services that are available. We have our internists, we have our pediatricians coming in. So we're not limited to only our medical clinic. We do have specialists coming in to our wellness centers. And in Soufriere Hospital, they have now expanded the lab services. So you can always come in and find out what services that are being offered at our labs and so on, to, you know, so that you can, it's just come in, do a normal checkup. It doesn't hurt. If every year you decide you're doing your yearly checkup, it really goes a long way. You do all your labs, and you do that checkup, so you know at the end of the day, I'm free, I'm fine. I'm not saying that you might not get sick later on in the year, but it all depends on what you do. And one of the things they tell you, you have the right to good nutrition. What you eat, what you drink is paramount when it comes to good health, because many of us have everything around us, but yet still we are still stuck up on all these processed foods, all these packaged foods, when we have everything around us, all our fruits, our vegetables. And I know people come with the excuse of vegetables are very expensive, but home gardening is something that is very good. You can practice. It is very therapeutic, especially when you're in your gardening, doing all your gardening work and so on. It helps clears the mind. It's a form of exercise also. So there are different things that you can do to improve your health. Do not wait until when you are diagnosed with a certain condition. Then you run the same thing you said that you could not eat, or I don't like this, I cannot stay without the cheese, right, Cabrina? I cannot stay without the milk. I like a mac and cheese too much. Every Sunday I must have my mac and cheese. Or I do not like eating guavas. And all of these things. I will not eat the guava, but I'll drink the guava juice. Some people say that. I will not eat the ripe banana, but I will indulge in something that has the banana in it. So, I mean, different people, different body types. People have their own preferences and so on. But as long as you can incorporate certain things to ensure that um, you live a healthier lifestyle, it's very good. Another thing we have to be mindful of, I mean, you don't eat the guava, but yet still you go and buy a guava juice, and that maybe comes from a different country, when you have the guava right here, a packaged guava juice. Does that really make sense when you can make your own guava juice right here at home? And you know the amount of sugar that you're putting in there, the amount of guava, the level of concentration, and so on. It's like, people say I cannot eat guava, I can only drink the guava juice. Well, make your own guava juice. There is no reason for you to go and buy packaged guava juice that has many preservatives in there. So you understand, by telling you this, you understand how much we affect our health by the simple things that we do. And we have the things around us. Around guava season, there is no reason why you cannot freeze the guava, or you cannot make the juice and freeze it until you're ready for it. So these are the little things that we can do now that we are young, we are in our prime. These are the practices that we want people to start doing, and don't depend on other people to do it for us. And that is all part of living a healthy lifestyle, is our everyday practices. And people fail to realize that, because we're so caught up with our lifestyle, busy hair, the fat in there. You have to visit all. You don't want to miss out on any opportunity. Sometimes you're part of so many groups, but don't forget, stress and can be a something that can really affect our health. It's true you want to be out there providing services out there, but at the same time, you're only one person and you can only do so many things at a given time. So I want persons to bear that in mind, um, as it relates to your health, your right, the simple things that you can do as an individual, as well as the services that are being offered to you at our wellness centers, our hospitals, our labs, and even the private sector too. Are we making use of these services? At the end of the day, it's your right to say yes or no, but think about it clearly before you make a decision. Right now, our nurse is running a little bit late. She's supposed to be with us. So in the meantime, I will engage. I will engage. Well, nurse is there, I think. So hopefully, when she comes in, we can speak a little bit more about the services that are available, and the services that are available to you, and what exactly have been we seen in our wellness centers, and what we really want our persons out there to partake in and so on. So, having said that, let me allow Nurse to relax a bit before she starts. Um, Let me just say this to and a little announcement was as an environmental health. They have agreed that they will be doing fogging in certain areas. So be mindful for all the services that are being offered at environmental health also, and that is all part of the services. So if you see the van around your community, I'm not sure which community, I was unable to tell you which community that they are fogging today. But as you well know, vector-borne diseases are part of our everyday lives, and to get rid of the Aedes aegypti mosquito, that is one of the things that they are currently trying to get rid of. So again, bear with our persons at environmental health whilst they do the fogging, and please respect our officers whilst they are engaged in fogging activities. So now that we now that we think, I'm going to let allow Nurse to introduce herself and can speak a little bit more. All right.
Good morning, Soufriere and the environs. I'm Nurse Harrison. I'm presently attached to the Lafag Wellness Center. And as we observe World Health Day, one of the things I want to talk about is why persons do not access health care. So, one of the main reasons is fear of the unknown or the obvious. A lot of persons, they may have certain signs and they know exactly what it can be. And because they do not want to be faced with the reality of what's actually going on with them, they will refuse to access professional help, sorry. And the other reason would be because they do not know. For example, women, you'll have a lump in the breast, and at the back of your mind, yes, you may say, well, this can be cancer, or this can just be a cyst, or this, but you do not want to face the reality of the worst case scenario. So a lot of times persons stay away because they do not want to deal with the whole mental trauma of being diagnosed with a condition that is difficult to live with. So they refuse professional help. Now, in our country, we know we have the highest numbers of diabetic cases according to our population. Now, we have a program sponsored by the World Bank to strengthen the screening and treatment of diabetes and high blood pressure. And the name of this program is called performance based financing, or PBF. I'm sure some persons have heard about this program. It initially started last year, July, but it has been in planning for the past 2 years. And presently, we have about 8 facilities participating in the phase one. And in our region, Region 6, when it comes to health, we currently have 2 facilities participating in the PBF program, which is Soufriere Hospital and Lafag Wellness Center. So, what does that program really offer? We do screening for diabetes. It's slightly different from what we know. So, normally you come in for a diabetes screening and they do a finger stick for you. But with that program, it's a lot more. We do the body mass index, which we call the BMI, where you have to assess the weight, the height, also your waist circumference. Because we know the more fat you have around your midsection, the higher your risk of being a diabetic. So, in addition to that, we also do a screening test where a few questions have been asked and you will be scored. According to your scoring, then you may require a blood test. So that blood test is called the HbA1c, and that is a test that will confirm whether you are a diabetic or not. After that is done, and if you're diagnosed as a diabetic, then you get counseling, because of course any new diagnosis requires counseling because it takes a toll on you mentally. A lot of persons consider being a diabetic just as bad as having HIV. They're very secretive about it. Many times you may be living in a household with a diabetic and persons don't know. And that's one of the things we realize in our screening for diabetes. There's a section where you have to ask the client whether they have a history of diabetes. And as a healthcare provider, you know for a fact their aunt, their uncle, their grandparents, their parents are diabetic and they don't know, although they have been living in house with these persons for decades. So one of the things we want persons to be knowledge about is their condition, and it's okay to be suffering with diabetes or high blood pressure. It's not like a death sentence. It's just a few life adjustments you have to do to live a normal life like anybody else. So in addition to the screening that the PBF offer, we also do an annual laboratory testing for persons who have been diagnosed with high blood pressure or diabetes. So this lab screening entails kidney function, liver function, urinalysis, lipid profile, meaning your good and your bad cholesterol, and HbA1c, and your blood count. Because when you're on treatment for a prolonged period of time, your kidneys and your liver are the two organs that really work under pressure. So you need to know whether these two organs have been compromised. So it's always good to have an annual checkup of your kidneys and your liver. So when this test is being done, you collect a voucher at either the Lafag Wellness Center or the Soufriere Hospital. So with the Soufriere Hospital, they have their clinics on a Friday. So you come in if you are a diagnosed diabetic or hypertensive client. You come in, you speak to your nurse, they write up the form for you, and if you are not in fasting on the day of your visit, you return in fasting so the test can be done. When the results are ready, you will receive your results at your wellness center, either Soufriere or Lafang, and you will see your doctor. Now, sometimes, since it's only two centers in the region offering the service, we do accommodate, especially Lafag Wellness Center, we do accommodate surrounding centers with clients that are diagnosed with the condition. So you could come into Lafag on a Wednesday. We do have the lab in on Wednesdays, every single Wednesdays. St. Jude Hospital phlebotomist will come down to Lafang where the test will be drawn, and whatever results that are ready, it will be at that center. If you're not a member of the Lafag Wellness Center, we encourage you to visit your nearest facility where your doctor will go through your results and that will be discussed with you. In addition to the PBF, we do have universal health care for maternal and child health. What this means is that every single pregnant woman in St. Lucia, once you're pregnant, you are entitled, unlike the PBF, you have to be 18 years and over, and you must be a diagnosed diabetic or hypertensive to receive the laboratory investigations with the universal health care for maternal and child health. Once you're pregnant, you come into the nearest health center. It's available at every single wellness center. You come, you speak to the community health nurse. She enrolls you into the program with a series of questions. And then, whatever lab that you need, according to our routine, then she will write up the voucher for you and you can visit either Soufriere Hospital or Lafag Wellness Center to have your blood works done. Your ultrasound can be done at St. Anthony's and medical imaging by appointment. And in addition to that, what we would want to see in in addition to that, what we would want to see at our wellness centers is a little more of health literacy. So you find a lot of persons are diagnosed with a condition, whether it be lupus, whether it be diabetes, whether it be high blood pressure, and they're not knowledgeable about the condition. They do not know the name of their treatment and so forth. So in this enlightened age, we expect our present generation to know a little more about your health condition, what medications that you're on, what doses are you taking, what time of day you should be taking it, what other treatment you shouldn't mix with this medication, and so forth. Sorry. And if you have any questions, you could always come in to your healthcare provider, the nurse, the doctor, the pharmacist, and ask them questions. Many times you find the clients, they go into the doctor, yes, doc, yes, doc, yes, doc. They go to the pharmacist, they hand their prescription, they get their medication, and they're busy looking for the health aide or the nurse and ask, how should I take this? Whoever issued the medication to you should explain to you what are you taking, how you should take it, and what side effects you're supposed to look out for. What are the complications? All these things should be explained to you before you start a treatment. And that is your right as a patient to know everything about your treatment so you could make an informed decision. Despite the fact that this medication is prescribed to you, you still have a right to refuse to take the medication, and nobody can dispute that. This is your right as a patient. So if you have enough information about that condition, you know, for example, okay, I am diagnosed with X, Y, and Z. I'm supposed to take such and such and such. I'm supposed to get drowsy when I start taking the medication for a few days. I should get a little diarrhea, and that's okay. Because some persons, they get alarmed, they get anxious when they start experiencing something that they were not told they should look out for, and they stop altogether. But if you know, as a patient, you know what to expect, and you're going through the process, you know, okay, yes, that is normal. No, that is not abnormal. What you should do in the case that it's not abnormal.
88.5 Sofa FM is now at 25 minutes, moving up to the hour of 11 a.m. in Surface and Lucia. And of course, the Eastern Caribbean. If you're just joining us, say good morning to you. Welcome inside Casualty 911.
Okay. So as we continue, I want to touch a little on men's health. So the men, most times they are left in the shadows, maybe because they're a little reserved about where they should access the healthcare, who is at the healthcare facility, what should they expect, what rumors they've heard about men who have gone before them to do certain examinations and so forth. But we want an increase in the amount of men that is coming for the healthcare. It could be a simple chat with your doctor. You realize, well, you're not performing the way you're supposed to. Get a male doctor that could really understand the way you're feeling. If you do not want to go to a female doctor and feel intimidated, we have a lot of male doctors in our region that you could come, find out who's working. It's your right to find out who's working. It's your right to choose which physician or which healthcare provider you want to offer that kind of care to you. So you find out and you come and have a chat with your healthcare provider and see what way we can move forward. What's the best solution for you? Don't stay in the shadows until it's too late. You have men that are ticking time bombs, as we say, where their numbers are out of control and it's just a matter of time before the body say, you know what, I've had enough. And they refuse to come. Some of them are just afraid to accept accept their condition. So you find they still go on living their normal lives, not making any little small changes that could give them a better chance of living because of that ego. So they feel like, okay, if I am go there and I accept, well, I have a condition, I'll be less than a man. No, that doesn't make you less than a man. That make you an educated man, a man that is looking not only for himself but his loved ones. Because the longer you go with a situation that needs to be dealt with, the higher the chance of you putting an emotional strain on everyone around you. Supposing you get a stroke, then you will be unable to provide for your family, and now you have to, maybe somebody have to quit their job to care for you, or you're left alone at home until somebody returns from work. The amount of care that you're able to get, you cannot get it because whoever caring for you is already tired from work. And all that could have been avoided by just early detection and early prevention. So we know that men should have their prostate checked from the time they're 40 years. And a lot of men shy away from that because they feeling violated because of the procedure to do the physical examination of the prostate, or they um hold on to the experiences that somebody told them that you will feel this kind of way and that kind of way. Everybody's experience is different. So I advise men, if you're 40 and above and you're hearing me today, please have a general checkup, including the prostate. It's very important. We also want to see a higher increase in the amount of women screening for cervical cancer. We know our cervical cancer rate is very high in St. Lucia, mainly because of a virus called the human papilloma virus, and it's very rampant. Now, because of the high rate, we have already started vaccinating our children as early as grade 6. But anybody older is at risk. So you have to be screening annually. Before, it used to be every 3 years. If you have free normal pap smears, then you wait every 3 years. But now, because of our high rate of cervical cancer, we encourage women to screen yearly. Do your pap smear yearly, and even though you have a normal pap smear, you still have to continue. You still have to continue doing your annual checks. And of course, we want to increase the amount of self breast examination that we do at home. Some persons, they tell you yes, they do the examination at home, but how do you do it? Are you doing it effectively? Are you doing it around the right time? In your period, we know that you're not supposed to be doing any breast exam close to your menstrual cycle. You have to do it either 7 days before the flow start or 7 days after the flow has gone, because around your period time your breast glands are all swollen, and this may give you a false alarm. Also, we have women above 50. You should do your mammogram. That's important. Whether you have any lump in your breast or not, it is a criteria. Just like the men over 40 must do their prostate check, women, mammogram is important.
Adding to that, in terms of the mammogram, and we women should, I think, well, I'm not sure, but there was a self examination that was told that we can also do it at home as well.
Mm-hmm.
So, in the event that something doesn't sit right, how are we able to tell? Should we still come over to the medical experts as well?
A very good question. So you doing your self breast exam at home is excellent. If you detect something abnormal, of course you come to your nearest health center and you tell your community health nurse, I did a breast exam and I felt something unusual. I'm not too sure what exactly is going on. So what the nurse is going to do, she's going to do an examination herself. So if she realized, yes, there's a lump, then the second step is to do an ultrasound of the breast. So the ultrasound will determine what exactly is there. And if it needs further evaluation, then it will state that maybe the breast needs a biopsy. And after the biopsy, then we confirm whether there is cancerous cells or whether there is something else. Because in the breast, you could get other things like cysts, you could get fibroids, you could get all these things in the breast. Okay.
Thank you so much for that. And even tonight, all those things can be done at the wellness centers.
Yes. Well, the ultrasound, the form to do the investigation can be issued by a community health nurse. After you have received the result, then you referred to a doctor for further investigation. So the doctor will go through the result. It could be a district medical officer, it could be a gynecologist. And after that, it depends on what the ultrasound says, then further investigation would be done.
Thank you.
You're welcome. So, in addition to our women accessing our cancer screening tests and our men coming in more often, we also want to see an increase in our childhood vaccination. Parents, you have a right to ensure that your child is healthy. Now, we have a lot of information on Google stating a lot of negative effects on vaccines and all the complications that you could get from vaccines, but make sure your information is from credible sources. So you find a lot of the vaccination preventative diseases like polio and measles and so forth because of all the anti-vax rallies on the social network. You realize that lately there have been outbreaks because the more children you have unvaccinated is the higher the chance of getting an outbreak. And all you need is an infected person to come in. If you have a high population that is not vaccinated, of course you will get an outbreak of that particular disease. And St. Lucia has one of the best vaccination program in the world. So parents, and it's free. It is free, parents. So take responsibilities. You're right to make your child as safe as possible. Because you find in we get our vaccination free, we refuse it, and when our child or our children get an opportunity to go to the states or get their citizenship, they will come in and take all these vaccines that the parents refuse when it was free, and these children have to pay for it in US, in Barbados, and so forth. So parents, it is important. It is important to keep your children healthy. So please, we want to see an increase in our childhood vaccination. Way before Google, a lot of persons had access to Google, you find we were more receptive to our childhood vaccination. Now persons are getting in touch with uncredible resources and they have been putting on a battle. It's very difficult to get the parents coming in. You have to literally go out into the community and literally beg the parents to get their children vaccinated. And we want to see a change in this because we want a healthier population.
True. Adding a little to not just finding the information pertaining to vaccinations online, but everything pertaining to overall health is on the internet as well. So sometimes, if we may have certain doubts, even before going to our various practitioners, this is where you get upfront information, so you're better prepared.
This can be a good and a bad thing. It could be a good thing in terms of you having
Maybe
a
type 1 or type 2 diabetes, and I want to know more of that information. what am I supposed to eat in terms of maybe changing my whole diet and well overall health. So I can seek, some comfort or guidance online.
Yes, we do encourage some guidance online. However, your sources must be credible. You could go to the WHO website, you could go to the PAHO website, you could go to the Medline website, because anybody can post anything on Google. So you need to know whether whatever you're reading is just from a random person, or whatever information you're extracting is research based. It has been tested and proven to work. Okay. In addition to that, we do have a comprehensive team in the community. So in nursing, there is a primary healthcare in which I work, and there's a secondary healthcare. In our primary healthcare, we don't work alone. So we have our health aides, we have our nurses, we have our doctors with their different speciality, we have our nutritionists, we have the mental team. So as you can go through the different groups and get a lot of information.
You have the health educator.
You have the health educator. Sorry,
Oh,
she's
yes.
staring right at me and I forgot her.
You know?
So you have a lot of information at your disposal, free of charge. So make use of the resources that you have, the good human resources you have available.
Thank you for that clarification. 5 minutes moving up to the hour of 10 a.m. in Super. No, 11, such an interesting conversation that I lost track of time. But nonetheless, we're moving on swiftly to the 11 o'clock hour. It has been very refreshing so far as well. I must commend you for imparting such knowledge. Some things I was, having my doubt and whatnot. But then, thank you so, so much for that as well.
Nurse, one of the things I've realized when seeking health care um, at our wellness centers is people fail to exercise patience. They have the right to health care, but many people do not have the patience because, they come in, especially in a medical clinic or even diabetic and hypertensive clinic, and they're always in a rush, even for pharmacy. They're always in a rush. And, over and over, you speak to people, you come here for a service. You expect to get good service. You don't expect when you go into the doctor's office, you come out right away. You expect the doctor to have a conversation with you, to ask you questions. So these things take time based on the person's medical condition. And persons fail to acknowledge and respect that because they always come in. They come in at 7, they expect to be out at 7:30. You understand? I mean, at 8, and they expect to be out at 8:30. And we have been saying that to them. Yes, it's your right to get very good health care, but you, as the patient, need to exercise some level of patience, some level of understanding, some level of respect to our healthcare professionals also. Because it's just not about coming to our wellness center. It's your health, your right. But at the same time, all of us have to play our part. When you speak about the team, you speak about the team of our healthcare professionals, but the patients are also part of our everyday lives at work, and they too need to understand, you know, exactly what the system is about and how they should exercise some level of patience when they come in. I do not know if you want to say anything further on that one.
Oh yes, I do want to say something. I think it's the way our people are cultured. So many of our persons, they stay within Saint Lucia. So they have not had a broader experience where wait is an entire day. In St. Lucia, we have the mindset that we want it and we want it now. But when you want quality, quality takes time. You would not want to come into a health facility, and by the time you sit, the doctor or the nurse is refusing to attend to all the concerns that you have, just get rid of you and the next person. No, you want your issues to be addressed. You want to feel lighter, that burden that you came to the center with. You want to feel like all your issues or almost all are addressed. So you need to, and these things take time. So you need to come in the condition. I always tell my clients, if you're going to come to me, request the day off, please. Because when I cannot rush the person before you, and when you come to me, you want to spend an entire day, it doesn't work that way. You have to put yourself in the person before your shoes. Do I want to have a rush service? Because that is one of the issues that some of the clients have when they go to the private sector. They go to the private sector, and most times, by the time they say two words, the doctor is already writing and a prescription is given to them, and then you're out the door. And you do not want that. And all the issues that you came with, you have already spent money on it, and you're living with these very same issues. So when you come to us, which is primary care, our job is a lot of promotion, a lot of teaching. So of course it will take some time. So when you come into the healthcare facility, request the time off, because it is time consuming.
Walk with water and something to
And
eat.
yes, I always tell them that. Walk with a snack, because when you're hungry, you get irritable. So walk with a snack, walk with water. And one of the things we're trying to do at our wellness center, we realize persons get bored. So in the near future, you will be entertained on a flat screen TV, where you'll be getting where you can watch some educational stuff while you wait. So it won't make the wait a burden.
I love how you phrased it in the near future.
Yes.
The services will be there soon,
Yes.
hopefully.
Okay, well,
Yes.
hopefully.
Yeah. Well, well, we do try our best to keep persons occupied at our wellness centers through various presentations,
Mhm.
and our health aides do come in and check on the persons out there if they're not so busy with triaging, and especially our elderly people or persons that come with disabilities. They do come and check up on them at various intervals to ensure that persons are okay. And another thing clients need to understand too, patients, is that especially our wellness centers, some of the elderly persons come in. It's true you came in at 8 o'clock and you see a 80 something year old person on a wheelchair come in. Of course, they will be getting some services. I mean, it all depends on the condition and so on. Before somebody like me that just came in, um, young, vibrant, and so on. Of course, based on the medical condition and so on, they will be given special attention.
Which is true. And if there were maybe some add-ons in terms of the waiting area should maybe be more attractive, like some brochures or different little
Mhm.
things as well. And even with the instances where children are taken as well, so the attention span of the kids, so
Mhm.
they definitely need to have some, fluffy, some decorative, you know, toys or even games or something to keep their minds engaged.
Yeah, I think some wellness centers do have children's corner. I know Maguish for one has a small corner where they encourage children to write and so on, where they have some of the children's essays up on the wall. I know Eton's is trying their best to start up a children's corner. So far, they've had a few things. So hopefully, it will grow eventually as time goes
Mhm.
by. So there is some, progress slowly, but we're getting there as time goes by.
Notice Liz is smiling. Um,
I
three
think so.
minutes after the hour. Any other talking points as far
Well,
as
somebody said it's a long wait, and that's why. too long now. People know they must have respect. Um, I said they said phone. They bring it with internet, open Wi-Fi. So Soufriere Hospital has open Wi-Fi to persons that come in. I'm not sure for all our wellness centers. No.
All our wellness centers in Region 6 should have open Wi Fi,
Yeah.
LAFAG as well. Some of the clients, they're not aware that some of our Wi Fis are accessible to them. So LAFAG does have open Wi Fi. I'm assuming that all the other centers in Region 6, including Margouge and Delse and Fosse Jacques and Soufriere, have open Wi Fi because that was a venture that was supposed to be done nationally.
Yeah. So um, slowly but surely we're getting there
Yes.
as it relates to certain resources.
Hmm.
So as time goes by, they will tend to other wellness centers. So um, so these things take time,
Yes.
and in the meantime, that is why we're asking persons to exercise some patience, especially when you want to seek medical attention at our wellness centers. Yeah.
Yes.
And I think that person said, um, why too long? It's a long wait. That's why. Um, People know they must have respect. Yes, people know that they must have respect, but we know different people, different personality, different culture in different communities, and some persons do not exercise that level of respect that they should have. Adults, you might be surprised, some of our adults do not exercise that respect even in front of our own children at our wellness centers. So that is why we're asking for that level of respect, especially to our healthcare professionals and other patients as well. So that's one of the things we need to understand. Some communities, persons sit quietly, I can tell you, but some communities, persons don't.
Hmm. I can attest to that since
What
I've
side was the
worked.
best community?
It depends on where in Swazel. I'm a Swazelian and I can tell you different areas. Let me just stop there.
Yeah, different
So one
communities.
of the reasons why you'll find a long wait because we're trying to accommodate persons. Persons don't keep to their appointments. So you have an overwhelming number of clients to the healthcare provider. So if we have to stick to appointments, if you did not have appointment today, you're not going to be seen. Then that will be chaotic because somebody would say, well, that's the time I could have gotten off and so forth. We're trying to meet persons more than halfway. So we need all we're asking for is a little patience because we're trying to give as much care as possible with the little human resource that we have. Unlike a private doctor, if you don't have an appointment, you would not be seen. And the numbers are smaller. So, persons, if you're going to come with your little movies, download them the day before. Hold your headphones, of course, because you don't want to be disturbing everybody until we get our TVs functional and so forth.
Okay.
Mhm.
In other words, make use of what is available to you.
Yes.
Having said that, nurse, is there anything else you'd like to speak about before we end?
No, I just want to close with the saying of the director of WHO: the right of health belongs to you. So make use of that right properly. Do not hold on to that right and harm yourself. Make yourself knowledgeable because knowledge is power. Have a nice day.
Thank you so very much, Nurse Harrison. I must say it was a good topic. Um, I am glad that we spoke about the services that are available at our wellness center, Many people know of the service, they tend not to want to utilize the service, or they always feel they have issues with the service. But until you come in, don't always listen to what you hear
Mm-hmm.
based on other people's
Mm-hmm.
experiences. Come in yourself and sit and talk to our healthcare professionals, and then based on that you can make your own judgment call as it relates to our services. So all I'm saying now is that according to the film My Health My Right, you have that right. Like I said, we're looking forward to seeing more men,
Mm-hmm.
especially at our men's health clinic and all our wellness centers, especially our young men between the ages of 20 to 45.
Mm-hmm.
Yes, we're really looking forward to seeing you at our wellness centers. Come in. It doesn't have to be a medical clinic day. Sometimes you can, whilst driving down or up, and you see the nurse, you can always ask a question, find out, and then based on that you can be guided accordingly. There is no reason why. I don't think any nurse will shy you away, especially when they see our male figures at our wellness centers. They're always really happy, especially fathers coming with their children. They're
Mm-hmm.
really extra happy to see these things. And that's what we really, really want at our wellness centers, for that group of persons to come in, and our male figures. So, having said that, I would like to thank all our listeners on today's program. Feel free to provide feedback. Again, for persons via social media, thank you so very much for your comments and so on. Um, Let me just say to that person, there is free Wi-Fi at Soufriere Hospital. No matter where you are at Soufriere Hospital, you will get free Wi-Fi. If you have your phone, just go there and try it. There is free open Wi-Fi. Um, Again, we're appealing to our general public, especially our mothers. Don't forget to start bringing our young ones to the dentist.
Mm-hmm.
That's one of the things we really want to encourage you. Get our children accustomed to the dentist, for them to come in so they will not develop a fear
Mm-hmm.
of our dentists. The services are there, they are available. Make time. Again, it boils down to our parents.
Mm-hmm.
You have to make time for our children, especially if you see you are accustomed of bringing your young men to seek medical attention. You have a family doctor, or even to our wellness centers, you take them, they get accustomed of coming in, and by then they will not have that fear in coming to seek medical attention. So have a wonderful day, everyone, and a blessed week. I'm hoping that I'm hoping that everybody will take all what nurse have said into consideration. Let me just say my final thing. Happy birthday to someone. I know this will going to give me a comment. Let me say happy birthday to a very important person in my life. I hope all goes well for that day. Do enjoy and have an enjoyable day. Nurse, I'm waiting for your comment after the radio program. So again, Cabrina, thank you so very much for assisting with the program today. I'm really grateful. I'm really happy. I must say, speaking to you before the program was, quite exciting. And Erlan, you will surely miss, as well as Rome. Thank you so very much. I know I had not touched base with you this morning, but you made it your priority. You always there and always providing that support. Thank you again. And of course, Soufriere FM for hosting this program.
Nothing more to say but the time check, 13 minutes after the hour.
Wow.
We now take a commercial break. When we return, we continue with the traffic mix. It has been a great pleasure. I fully endorse, and too bad I won't be here next Monday.
Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine if you're on 88.5 Soufriere FM